My treatment philosophy is two parts to it. The first part is it's my job to figure out why the person's actually there. So not just the sequence of symptoms that brought the person to the office, but a little bit about how that's having an impact on the person's life, what kind of effect it's having, what sort of meaning the person is wondering about. What does this mean for me and for my future? What implications does this have? What am I hoping for? What are my fears about what's going on? And what am I hoping that's going to come from this visit to the doctor? So that's my first part of my obligation, what goes on during a visit, I think. And then the second part is what's the management plan that we can come up with? So what will I feel okay about as a physician, knowing the research and the medical evidence and saying, I'm okay with this, and what can I work with the person that they're okay with doing, that it fits in with their values, their history, their goals, their future, and so that's my two parts to my visit. One area of interest is quality improvement and improving the system of care, but another is evidence-based medicine, which sounds odd because people then ask, well, if medicine isn't based on evidence, what's it based on? So, but it's really taking research and finding what's practical in that research to apply to a given situation. So I like using web-based resources, sometimes at the point of care, to pull up and look at with the patient, and then go through the research and say, this helps you, this doesn't, this is what we can do based on that. I think one of the obvious reasons to choose MUSC is the wealth of expertise that's here. Just the breadth and the depth of care available at the MUSC is superb. So we are the window to that, and I can help folks get into that system and get to the right person at the right time and the right test or the right person at the right time. You know, the other reason is we are a wonderful clinic in and of ourselves. We're a patient-centered medical home at the highest level of certification, and there aren't that many in the state that have the highest level. My partners are excellent. I've never found better physicians in all my practice. The front desk is wonderful. The staff is great. The business office is great. The nurses are terrific, very accomplished and very helpful. And we actually have a nice collaboration with pharmacists who are also diabetes educators who help in the care of folks who have diabetes or who have clotting disorders or a clotting problem. And that kind of team-based care, the entire team is really just great, and it's wonderful to work there.